Well, thanks so much for watching Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, and I'm joined by my co-host, Dr. Apoorv Gupta, and today we are excited to welcome Wade Mitzel, who is the CEO of UofL Physicians. Thanks so much for being here.
Great to be here. Thank you.
We, as always, had a really lovely conversation before our recording. And I think the place I'd like to start is that you've been at UofL Physicians for years, but you've been in your role of CEO since January of 2025. And so you told us that there are three things that you're focused on, which is love patients, be intentional, suffer well with them. And then the second thing is care for each other. And the third is build healthier community. So I would love to just hear how you came up with those three and why those are so important to you.
Yeah, thank you. And I think in healthcare today, we're always focused on, well, patient-centered care and some of these words that just don't mean anything to us anymore. And we all have a lot of the same taglines and stuff. And I wanted to be very simple and very explicit about, you know what, we're going to do something different. So we're not just going to be patient-centered and innovative and all that, but we are going to love our patients. And love is a very crucial word, and it's a very intentional word that, I think of love as not just, we're going to see patients, we're going to have good access to our system, but we're going to do something different. We're going to walk along that journey with each patient, and we're going to help them and remove barriers and do something special, and create environments that, help patients get what they need, but then also they see hope. And they understand that there's more to just the healthcare than just that visit or just that hospital stay. So that's very intentional. And then two, I can't do it without the great people I have. And healthcare, there's so much noise today. There's so much financial noise and things changing. And I'm like, listen, if we just care for each other, if we watch out for each other, if we try to make workplaces where people can flourish, where we change the conversation of not just burnout, but how can we make people just do well and be well, that will change, that will make our patients healthier. And the last one is, of course, building stronger communities and healthier communities. We have a lot of sickness and cancer in the state of Kentucky. And boy, it's our job as a large academic medical center to reach these communities and do a better job of just making an impact and building healthier communities, like the screenings and the different components that maybe they don't get when they're living in a rural setting, that maybe we need to do a better job bringing it to them.
I love that you come from that. It's from such a genuine place. It feels like you're living those things and that they really matter to you. And when you were talking about it, I couldn't help but thinking, you said, I didn't want to use the same words that everybody else does. And I was just literally thinking of like somebody stirring like a witch's pot, and there's all the words like innovation, all the buzzwords, that everybody uses. And it's like, okay, or those things on Facebook, maybe you should have done this before you got CEO, or some people would. They go on Facebook and it's like, these are the 4 words for your thing. So it's like innovation, but you didn't do that. But that's what it feels like some people do. It's the same stuff recycled again and again. So I just, had to share that I love how you're genuinely focused on these things, and it obviously matters to you.
Yeah, that's interesting, Stephanie, that you jumped in, because that's exactly what was coming up for me. I can, just as Wade is talking, you can feel how authentic this is and how deeply felt it is. It is just words, but it's more. The words really mean something. A few simple words that you've strung together, right? Love our patients, care for each other, healthier communities. That's probably 7 words. And those words can be so powerful together. They're so simple, and they can yet create so much inspiration. So I guess that's my question, Wade. You've been the COO for UofL Physicians for several years. And then this January, you said you became the CEO for UofL Physicians, and kind of helped to bring together this vision that's truly authentic. How is it going? How is it being received? Are people saying, "Yeah, we get it. We want to be there with you on it"? And are they starting to deliver on this?
I think the one thing that I've liked about the words I chose is that it resonates with people in healthcare. We all got into healthcare to make a difference. But healthcare is so hard, and we've made the processes so complicated that sometimes that is lost. So it's been going pretty well to the, I round in the different practices. There's, like 260 practices within our system. And I go meet with leaders and people and I ask them, how are you caring for each other? And at first I would get this, they would tilt their head a little bit and look at me like, what are you asking me? And what's the correct corporate term I'm using? And then I would point out to them, hey, I just heard you had a potluck for Susie who had a baby. That is awesome. Thank you for doing that. Things like that. And then they're like, oh, okay, I get it now. Now they're telling me when they're doing that and things and reaching that component. Or I'll get emails about, you know what, we had this patient that got cancer and I helped them walk along their journey and get them to the 14 places they needed to get to. And it's really changed our conversation and a little bit of the culture. I would like to think our culture is getting better. So I pulled some stats and like our retention right now, our industry is so tough and it depends on what stat you get, but like for a medical group, a typical stat median is like 18 to 20%, turnover. And we started last year at about 19%, and we're probably going to end up this year at about 13 or 14%. So we are keeping a lot more people because I think that they realize that, okay, this is a mission I can get behind and something that, resonates with people. And that's, if you can resonate with the heart of a person, you can change the world.
That's just amazing. I mean, we just have to let that sink in and let your words resonate with the heart of our hearts and the hearts of our audience, because I think that's so powerful. What it reminds me of is that, Wade, you've been on this journey a long time. And actually, I know it's very, very deeply held. It's very personal and it's very faith-based. I just want you to maybe share a little bit with the audience as to why you're such a deep believer in this idea of compassion and love and caring, and why do you think it can make such a difference in healthcare? There's outcomes you've just experienced for yourself personally, or just what you've witnessed as a leader, or what you've read about. Please help us understand how you kind of came to this place.
I'm going to give you two main points to this. So someone came and told me once that it was many years ago, and made the statement to me, you know what, compassion is leaving healthcare. And I'm like, that's not true. What's the science behind that? And when I started to look at the research and the science, I'm like, there's studies out there that really confirm that compassion, that healthcare is not as compassionate as it used to be. And you can blame a lot of things and look at a lot of things, and there's a lot of reasons why that is. And it's not because our people don't care, but it's just so many other factors, just the business, just the, relationships with different components like payers and all that, and the financial situations and stuff. So it's just, you get to see that. And then to read about how there's science behind how a compassionate leader can make an organization more resilient. It can also improve the health of people. It can lower blood pressure. It can do all these different things. So I'm just like, if I don't be a good steward of love and compassion in my organization, I'm not doing my job. So it was very personal for me. Also, I have a child that is going through some pretty serious health condition, and I'm in healthcare a lot as a parent and as a patient, or my child's healthcare journey, and I need it as a parent. I need that compassion. I need someone to come alongside me and say, you know what, I'm going to help you get that next appointment, or they're not answering the phone, I'm going to help you, and just it's personal. So I realize that I'm not only a CEO, but I'm also a father and a patient, and I have to do what I can to be a good steward of everything that I'm in charge of.
It's interesting. Obviously, that's going to impact your view, but let's be real here. You are the CEO and you were the COO. So you did have the ability that if you needed to pull strings, you could. So the fact that you don't necessarily do that and you think, okay, I'm a patient here and I need these people to do this organically, I think really says a lot about you too, because you're living that. And so that builds so much credibility with the people that you're working with and the people that you're serving. You're in such a unique spot to be able to show people how you're loving your patients and why that's important, and caring for your team members.
Yep.
So when you're trying to do that, and I mean, you're authentic, so it's just coming across, but there are organizations that struggle with this. And I actually talked to somebody yesterday who said it was a bigger hospital system, and they said people have pride in their individual location and they identify with that. But if you said the overall system, they don't like, oh no, there's not that cohesive feeling. So you do have many different locations and you're trying to tap into these local communities. And I feel like the building the relationships in the communities is probably that same thing that you're trying to fix, for lack of a better word. So what is that? How do you do that? How do you get that from where it's a locational or situational thing, maybe it's departmental within an organization, to the point that it is then a pervasive feeling of like a heartbeat within an organization, no matter where it is?
Yeah, and I wish I had just this perfect answer for you, but I don't. But where I would go with this is having a level of curiosity. So when we were opening a new clinic in this town, and I met with some of the town leaders, and I said, what do you need? How can we care for you? And I said, not just what do you need, like X-ray machine in this building, but how can we actually care for you? What are you struggling with? And they said, they have some, a lot of people that are missing work because of heart conditions or back injuries. We really need some help there. And I said, let's see how we can partner and come together. And I want to care for you. So tell me how I can do that. And when you say it like that, it just changes the conversation. Instead of, we need an X-ray machine at your new clinic, or we need this. It's like, you know what? I have people that are hurting that, don't understand the social determinants of health and how food plays an impact. And I said, you know what? That's great. So instead of bringing a neurosurgeon and bragging that I'm bringing a neurosurgeon to your company, let me bring a social worker that talks about food. Let me do something like that. So it's changing that conversation. And when I go to the facilities, I challenge them as well. Like, how can we care for each other? And they roll their eyes at me a little bit, because they're peers. But then we have some really good conversations. I think you got to be willing to just ask those questions, not come in knowing that, okay, I know how to have a loving organization and I'm just going to force my, things on you. But it's really that from a point of curiosity and asking what they need, I think is just crucial.
Wow. Wow, being curious, asking what they need, listening to them, then, obviously before you can, before acting, that's just amazing. Another step, you just used the term, Wade, as you know, we're kind of all working together, all of us, all three of us are in the Loving Organization Consortium, trying to build out this awareness that our exemplars out there, like UofL Physicians Group, that are loving organizations and aspiring to be even more loving. One of the things that we found as we study these very small number yet of loving organizations is that they try to leverage a systems-based approach as much as possible. Maybe it's a little bit of an answer to Stephanie's question. It's like, how do you make this more system-wide, organization-wide? It's partly through the people and the relationships, but then it's partly through like the HR policies or through the workflows or through the technology. So I wonder if you have any ideas or examples of that from U of L Physicians Group or any others that you're maybe contemplating as ways to systematize love and compassion into the culture.
I hate to say this because everybody talks about this, but I do want to bring it up for a minute, is AI. So using more AI. So there was a study done that I just recently read that showed that notes from the physician that used AI came across as more compassionate than just a note from the physician. So an example is, a physician at the end of the day is writing 12 notes of, a patient asks, hey, can I increase this med? It's not quite at the right level. And the doctor says, yeah, that's fine, go ahead. Where AI says, oh, I'm so sorry you're having this issue. I think that's a good idea. Let's go ahead and move forward. And if you need anything else, please reach out. So I think using some AI and improving processes to incorporate, it's got to be the underground or the background to everything we do is compassion. So we optimize AI, we optimize our EHR so we can be more compassionate. We implemented a thing called DAX, which listens to a clinic visit and then documents it in the note. So the physician can look at the patient and not touch their computer. but everything is being done, so they don't have to stay late. And my physicians are getting out on time. They're living a better life. One physician told me, he said, if you take that away from me, you will be dead in a dumpster and next week. So I said, no, we're not going to take it away. It's a great thing. So optimizing everything, but in the background, making sure that the policies show a loving organization, making sure that, everything is in a line, but it's up to us leaders to make sure that happens.
So going to the leaders, which, you talked a lot about people, you talked, Porv was asking you about the process. And when we talked in the pre-interview, I asked you, I said, You've been here for a long time. Obviously, you have these immediately came up with these 3 areas that you want to focus on. So you obviously did see some things that you thought could be optimized, but to be at an organization and stay for a long time, you obviously have to see the value and feel, that you're really contributing well. So what is it that all those years kept you there, but then made you say, okay, I know when I get into this position that this is what I'm going to tackle and here's how I'm going to do it. And this gives me the hope that we can get to that optimized place that I've always imagined for us.
And that's why I think too, like the Loving Organization Consortium is so crucial, because I was blessed that I had a couple leaders that believed in caring for people and loving patients. And I was able to come under them, and they supported that vision. And there was that safe space of, yes, let's do this. And here's how we can do it and things. And if you don't have that, how tough this work can be. So organizations like that are focusing on that, where you have support and ideas flowing and research, I just think it is crucial. On podcasts like this, to say that people know that, hey, there's a bunch of us out there that really focus on this, that think it's important, that see the value. And instead of getting frustrated and leaving healthcare, we need these people to come around each other, support each other, build innovative ideas, and then help move healthcare and other industries forward.
And to your point, when we have the show and we talk to other leaders like you who share that same vision, they've never come on here and said, okay, you've got to buy this technology. You need to have this. You need to have, it's always the people, the compassion. It's the things that are available to everybody without money. And that's what I think is so important for people to hear, that there is always a way forward and a way with hope. So Apoorv, final question or two, because I'm sure there's
Oh,
one or
yeah.
two in there.
Well, I'm glad you said or two, because I was a little bit worried that it was coming, that close. But if I have two, I guess I'll ask one of them, which is that, Wade, you mentioned the impact that you've seen that this can make, compassion and love can make, in all the dimensions of the community, the patient, and the staff themselves. And you said that you've already started to notice that there's some improvement in the turnover. Fewer people are leaving. I just wonder if is it, any evidence of this impact in any other sphere, quality scores, patient experience scores, safety, potentially burnout, if you're measuring that, and/or profitability. These are kind of some of the areas that our loving organization exemplars have been able to start demonstrating that just taking care of our people and taking care of our patients the right way is actually going to lead to all the outcomes that we want.
Yeah, I would say, I've been on this journey where I've been the leader that has been saying some of this for probably 2.5 years now. During this time, we've seen our turnover within the physician group decrease by, it's going to be probably 10% over this time, that we're below national, benchmarks and things like that. So I'm keeping on average an extra 300 people a year that are deciding to stay with our organization. And I'll be honest, we're a university system. I am not the highest paying people out there. So organizations say, well, I can't pay what everyone else pays, so that's why my turnover is what it is. I would disagree with that. That if you bring a loving organization culture to someone, you will keep someone. They won't leave you for 10 cents an hour to go to the competitor. The other thing is our team member engagement scores are one of the highest in our organization. So that has improved dramatically. And I just think that there's more involvement, and people are coming to the kind of up to the plate to help out with process improvement, and there's just engagement, things like that. None of that, but I think there's a level of psychological safety where I've had people say, you know what, because you say, loving patients and caring for each other, it just feels like I'm valued and it's safe here. So I know that if I do something wrong, I'm not going to be fired, or that, we're all going to get in trouble, that, there may be people that come around me, but they're going to look at how to make things better, not how to punish people.
First of all, I just say that's amazing that you're seeing that kind of impact across the board. That's really what we are trying to, to get out there in terms of the message to the world, is that this isn't love versus, financial profitability and viability. This is the way to long-term sustainability and viability by better taking care of our people and, producing healthier communities. That's what we're in the business for. So I really haven't come across any other model other than a loving organization that can deliver that. And that's what makes me so excited to meet with leaders like you that are proving it and delivering it. So I love that. So that's just kind of my my acknowledgement and my hats off, tip of the hat, literally to you for that. I know that you said earlier when we were talking in our pre-interview that the faith is a big part of who you are and what has brought you here, and certainly the family and your commitment to your daughter is a lot of what's brought you here, as well as just your commitment to healthcare in general. But I'd love for you to maybe connect the dots a little bit more with your faith and what it means to you, and how that's helped you come to this place of realization about what the role that love and compassion need to play in healthcare.
Yeah, my faith is crucial to this. And I think I would do a disservice to myself, but my team and the organization if I just disconnected, where I was CEO, 8 to 5, and then, faith was important the other times of the day. I think that in order to be a true loving organization, the soul of who you are has to come out. And if you disagree, or if you're acting in a way that is, you know, that there's dissonance then, and it just doesn't line up. And I think that's going to add a level of stress that I don't know how you can be a loving organization without tying into that personal journey and that faith as well. Because, and two, I think that when your faith is forward and not hidden behind, I just think that that authenticity, that heart shows more, is just resonates more. And I think that plays such a factor in changing a culture. And it just, not only that, but it helps me avoid burnout. It helps me, stay the course, that when there's chaos, that I can be calm, because it all aligns, and it's crucial to who I am as a person, that I'm not trying to be someone different. So I think that that helps. And I've had people say, wait, I don't know what your faith is, but I'm going through a difficult time. Would you pray for me? And I'm like, yeah, I will definitely do that. And it's just, so there's something that is seen that gives them a place of calmness and a place of vulnerability that we're going to need, as an industry, to move anything forward. So I would just, and I'm not here to talk about what faith, but the faith that you have, don't hide it. And as a leader, I would just challenge you, let that come forward, because it's going to make you a better leader.
I think in general, what you're saying is that people need to be able to have the freedom to be their whole selves all the time. It's going to be really hard to manage for people if they're one person at work, and they're one person at home, and they're one person with family, or one person with their softball group or whatever. You just can't be for people. You got to be you all the time. And then you have the ability to work at those highest levels. So with that, when you have these people who feel like maybe there's something inside of them that says, I know I can make a difference. I know I can do this, no matter what role they're in. It could be somebody who's a custodian. It could be somebody in the food services, something I have absolutely no talent in, by the way. Or actually, the custodial leader. I'm not good in any of those areas, Wade. I need all the help for everything there. But it could be a doctor, it could be a nurse, it could be somebody who's in accounting, but they feel like they can have a change to positively help their organization. How do you tell them or give them that inspiration that no matter their role, that they can do this, and where to start?
Stephanie, I have to tell you this story because it's crucial to this conversation, because I tell this story at every orientation I speak at for new employees coming in. So I'm going to give you the short version. So if I go too fast, just let me know. But we had a patient come into one of our, well, actually, on this day, I got this letter, and it was in this envelope, and it said confidential, and it had a bunch of names that were crossed out. It looked like a CIA document. And it was from one of my practices. And it was from the physician. They said, Wade, we got this letter in the mail. We want to send it to you because you talk about loving organization and compassion. And I want to share this with you. But I blocked out all the names because we don't want credit. So it was from a patient that was that they got the letter on a Friday. This patient was in on a Monday. The patient came in, he was a 25-year-old male, and in the letter, he said, I had an appointment on Monday at 2 o'clock, and I had planned that at 5 o'clock I was going to kill myself. And I'm reading this letter, and I'm like, why would you go to a doctor's appointment if you're just going to kill yourself and a few hours later? And in the letter, he says, I wanted to, this was going to be my final proof that no one cares about me. So he comes to our practice and he goes to the front desk, and the front desk, it's front desk lady says it's going to be a little bit of a wait. So he goes, of course, it's healthcare, right? It's going to be a wait. But then he goes and sits down, and the front desk person just starts talking to him and says, did you notice how wonderful it is outside? How the sun is shining, how bright it is? And he's like, yeah, whatever. I don't really care. And then she goes, did you walk by that tree and hear the birds singing? It was just awesome. Isn't that awesome? And then she starts telling a story about her kids. And finally, they're both laughing and having a good time. And and the front desk person, you're going to see Dr., and I'll make it up, Jane. And Jane is such a wonderful provider. We're so glad you're here today. And you're going to have a great appointment. So thank you for coming in. The MA calls him up and says, please come on back. And what are you here for? And the MA says, we're so glad you're here. You're going to see Dr. Jane, and she is wonderful. Is there anything besides I see you here for just a first-time visit? Anything you'd like to bring up? And he wasn't going to say anything, but he said, well, I could have my meds adjusted. And she goes, okay, I'm going to put that on the list, and she's going to talk to you about that. The doctor comes in, and she could tell that something really wasn't right with this patient, that he was kind of distant and stuff. And finally, she put her pen down and she looked at him and said, you know what? We're going to adjust your meds, and I'm here with you. And we're going to check your meds. Please, in 3 months, I want you to come back and let's look at your meds, and we're going to fix this together. And she said, now you don't have to wait 3 months. If you feel you need some adjustments, just call me or send me a note, and then we'll do it that way. But we're going to take care of this, and we're going to make a difference. So then she goes to checkout. He goes to checkout, and the checkout lady says, we're so glad you're here, and I see that you need an appointment in 3 months. Please call us if you need anything. She put a note here that you might need some stuff. We'll be sure to help you any way we can. So they made the appointment, and then the bottom of his note, he says, I will be back in 3 months.
Can you imagine
So
being any of those people and getting that note and being like, you had no idea that you were that instrumental in saving a life?
Yeah, and it wasn't the physician, right? It was the front desk, it was the MA, it was the scheduler. They all made an impact. So those people, so when I go to orientation, I say, listen, you are saving lives. You are making an impact. You can make a difference. Please love our patients.
Something as simple as caring and saying, we're glad you're here, literally is the reason that man is alive.
His life was going to change after that appointment, no matter what. So it was either going to
Unbelievable.
be really bad or really good. And that clinic did something else.
What a testament. I mean, he could have ended up a patient in a different way, and I'm glad that he had the experience before it was in a tragic way.
Yeah.
It's so touching. What an incredible, heartfelt story. And it just kind of illustrates it's not a fantasy. This is what played out. This saved a patient's lives. I mean, this is really what we're talking about. We're talking about taking care of each other. We're talking about taking care of our patients. We're talking about taking care of our communities, and you just illustrated such an incredible example of the simple ways in which we can do it. You know, it's very, very touching. Thank you so much, Wade, for being here, for inspiring us, for inspiring your team forward, and hopefully we're hoping countless other loving organizations to emulate you in this leadership approach.
Well, keep sharing. I'm so thankful for you guys. Keep sharing the mission, keep doing the great things you're doing. And it's truly been an honor today. So thank you so much.
It was amazing. So much to take away from this interview, and we hope you all enjoyed. And thanks for watching. I'll talk to you soon. Bye-bye.